So next up, we have this scenario. Kindly read it and then we will continue.
Okay.
So what are the major risk factors for gastric cancer?
Okay. Major risk factors for gastric cancer include H. pylori infection or chronic atrophic gastritis. Yes, chronic gastritis, atrophic gastritis, H. pylori infection, cigarettes, smoking, uh, yes, family history, and sometimes other genetic conditions. We can give us to
So what is the
gastric cancer.
okay? So what is the most common histological type of gastric cancer?
Actually, the most common histological type is adenocarcinoma.
Okay, so
Precisely,
what other tumors in the stomach you know of?
yes, other tumors in the stomach will be GIST, gastrointestinal stromal tumor, maltoma, opposite-associated lymphocytic tumor, lymphoma, carcinoids. Yes, these are some other uh tumors that could be harmless in the this as well.
So what is the role of CDH1 in the development of gastric cancer?
Okay, CDH1 uh is a gene. It's an epithelial adhering gene that when it's mutated, when it's mutation, of course, that can give rise to gastric cancer formation.
Okay. So what is the criteria of screening for CDH1 mutation?
Criteria. Okay, I think I'll come back to that.
Okay. So discuss the pathology report with the family in simple words.
Okay, for this patient, I'll tell the family that the patient has cancer, and the cancer uh, uh, has separates beyond the stomach. The patient has cancer of the stomach, and then the cancer spread beyond the stomach, and the surgery done has not removed the cancer completely because this business involved I know there is a cancer at the margin of the business, so there is I mean the cancer is not removed for the surgery, so there is possibilities of going back, and the patient, lastly, the patient will need further treatment in form of chemotherapy.
Okay. So 7 to 10 days later, the patient develops axillary vein thrombosis. Which factors predisposes the patient to develop axillary vein thrombosis?
Okay, the factors will include uh, uh, stasis, axillary vein.
Yes.
Okay, yes, the factors could include stasis because of yes, stasis would also be hypercoagulability because of the cancer state of malignancy. It could also be also from stasis. Immobility. Immobility because of long stay in the hospital. admission going for surgery, and also stasis medical from probably lymph node enlargements.
So 6 months later, this same patient developed ascites, deranged liver function test, hepatic metastasis. What two tests you will perform to reach the diagnosis in this patient?
In this patient, I will check our aspects, I'll do parasynthesis for the cells. To analyze, to do cytology to establish the presence of malignant cells. Then I will also do, um, yes, I may do abdominal CT scan that can show me the presence of the ascitic fluids, the liver metastasis with the features of umbilication on the liver, yes, on the liver as metastatic features.
Okay, so what will be the treatment for this patient?
Well, this patient has advanced disease, so his treatment is mainly palliation. It's mainly supportive to control pain, to give him adequate nutrition. Uh, yes, that is nutritional support, pain control, and then control of anemia by giving a supplement or both transfusional as the case may be. Yes, a clinical support. So in essence, the treatment of this patient will involve a multidisciplinary approach involving the gastroenterologist, general surgeon, gastrointestinal surgeon, oncology, clinical oncology, surgical oncology, and specialist nurses.
Okay, so after performing surgical management of this patient, the patient is likely to develop dumping syndrome. Can you explain different types of dumping syndrome?
Whereas Edenton syndrome could be early Dempsey syndrome and late Dempsey syndrome. Early Dempsey syndrome usually occurs within 30 minutes after meal, and this as a result of hyperosmolar food contents in the bowel, they extend into the bowel, whereby the asthma, the hyperosmolar will cause massive fluid secretions within the small bowel. The patient can present with vasomotive symptoms, diarrhea, abdominal cramps, and weakness, hypertension, even collapse. While the late Dumpy syndrome occurs within after 30 minutes, like 1 hour after meal. This is as a result of massive absorption of high calorie content of the food with a high stimulation of pancreatic yes, of pancreas to secrete, to release large volume of insulin, thereby causing active hypoglycemia. So patient can present with hypoglycemic symptoms in about 1 hour, 2 hours after meal, whereby patient can have sweating, tachycardia, and even fainting attacks.
Okay. So what is the criteria for screening the CDH1 mutation?
Okay, the criteria I think have presence of two. Well, there is presence of two family.
Yes, 2 or more documented cases of gastric cancer in first or second degree relative, or diffuse gastric cancer before the age of 40 is without the family history, and families with the diagnosis of diffuse gastric cancer and lobular breast cancer at least before the age of 50.
Or, 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 that's